Joy, go ahead. Yeah.
Hi, I just wanted to ask Greg really quick about the sense, because I have someone who got the sense and is being monitored because she was just in the hospital for pneumonia. But the sense's numbers are so different than the readings of a pulse ox and what she knows her the oxygen and her pulse to be. We rebooted it and it was better, but it was still wonky. And she's stopped using it right now because she's afraid that she doesn't want to have the treatments based on readings that don't seem to be correct for her at the moment. And I just wanted to ask his advice on how to proceed with that.
Well, what I've discovered is that you are comparing readings that she's receiving PMF treatment, which is altering her body. So, and then you're getting the readings. When she's getting her readings from the medical community, she is not receiving PMF at the same time. So you really can't, you're comparing apples to oranges. It would be just like when you go to the doctor, when you take your blood pressure, you have to put your arm in a certain position to get accurate readings to be able to compare, because they will then compare your different readings, but you have to have your arm in a certain place. You can't compare a blood pressure reading when your arm is up in the air to where you're laying down. And when you are using the sense's intended purpose is to provide a more dynamic pulsed electromagnetic field experience, utilizing heart rate variability as the indicator of whether or not to adjust the magnetic field parameters. It's not used to diagnose anything. So simultaneous, while she's getting these readings, she's also getting PMF therapy, possibly utilizing light and sound therapy. So her readings may be a little altered or maybe a little off, because she's comparing her readings to when she's not getting the PMF, which is a completely different environment.
But the readings from the sense are so much less. Like,
well, you're trying to diagnose from the sense, but that is not the intended use. The intended use is to get the reading and then adjust the parameters of a magnetic field. And when you look at the totality of the readings from the recorded history, you can then see the averages. But there will be in heart rate variability, it's called artifacts, where you will have readings that some are high, some are low. And then when they do the cubios, they scrub it and they take out the anomalies, the artifacts, and that's how they get the reading.
I see.
We're actually seeing the raw data being transmitted with the anomalies in the artifacts in it, because that's not the intended use to diagnose anything. It's more like an educational reference where you will be able to see the pulse ox, and then that is, or the heart rate variability, and then those are used as indicators to move the magnetic field parameters as they adjust.
I see. One thing, I just was wondering if we should have it checked, because when she put pressure on it, on her finger, the readings changed. She shouldn't have to do that, right?
Well, I mean, I'm not, again, we are, almost talking apples to oranges. You're trying, the PMF,
I'm still trying, I get it.
The sense is not going to diagnose her readings.
Right.
It is just going up and down. If you want to try it on another user. What readings do they get? Put somebody else on the sense. And that's what I always, and see what it is. If somebody's going through medical challenges, they may have poor circulation. So they may have different, if they're moving around, if you are 100% focused on the reading, you are not getting any PMF, you're agitated, your stress levels go up, you're increasing your blood pressure, you are bringing your, when you get on, I tell people, if that reading drives you crazy, put a towel on it, because it's ruining your health and it's ruining your PMF experience. You should not even look at that until after the session is complete. And because the first thing you want to do is, if you're hydrated, you want to make sure you drink water. Then you want to lay down and you want to deep breathe, because you want to be able to relax and calm as much as possible in order to get the most beneficial aspect from the PMF. But if you are agitated, increasing your sympathetic nervous system because you're all angry at the number on the screen, then you have to just stop looking at it, because it is not doing anything to improve her health. And in fact, it's actually deterring her from improving her health by not utilizing the device because of a number that is not going to be the same number. Because it's like, when I drive my car on the highway, it says 80 miles an hour, but when I drive my car on the country road, it says 25 miles an hour. And it's because you're on a different road. And that's the same with the reading. That system is giving you a reading based on a body that is being stimulated by a magnetic field. And when she is getting a reading with a medical professional, they have her in a standard position, still and calm, and they get their readings. So you can't really compare them unless you look at the averages from the records management system. And you can print out all the raw data, and there's sometimes 30 pages of data, and you can print it out, put it into an Excel, and you can see the averages then. And that is what I always tell people to compare, is the averages, and you do it over time. And that is where you'll see more accurate numbers. But you could lay on that device and all of a sudden you could see 180 heart rate. But we are not in a medically acceptable body position or environment to be taking diagnostic measurements from the body. You're not even supposed to be talking. A lot of times when people go and lay on the mat, they're talking, they're laying down. Why isn't this doing this? You're not even supposed to be doing any of that type of movement when you are taking accurate medical diagnostic type of measurements.
Thank you so much. I can explain that better now.
Yeah, and that's it. And it's really preventing her from getting the benefits of it. But I always tell everybody, because she's not alone. That's like 80% of the people who use the Sense have that same question and concern. So she's not alone. And that's why I always tell people, sometimes it's best to start it, lay down, and then look at it afterwards.
Right, it's true. Because one of the numbers once was 0, and that was just.
Mm-hmm. Yeah, so I mean,
and a bunch of the other ones were so, but now I can explain it about the whole difference in the focus.
Setting.
So,
yeah, it's really the setting. And think about the medical professionals. They have you lay in a standard position. It's quiet, no talking, and then they take their measurements. And generally, most of the time I see anybody with the Sense, you're sitting down, you may be having a conversation with another person in the room, your arms are moving, you're trying to get yourself comfortable on the mat, you have a pillow, and then why does it say 0, So it's a different environment, but it does not, because some people always think of this, some people use the PMF and get benefits and they don't even have a Sense. So the Sense has no direct effect on the benefits of the PEMF in a sense, meaning that there's nothing the Sense can do to ruin her PMF session.
right.
Yeah,
good.
so
That's also
so
good
it doesn't
to know.
matter what the numbers say, because there's nothing that can ruin her PMF session. The Sense can just provide a more dynamic experience, but it cannot diminish the experience.
Great, Greg. Thank you so much.
Thank you. It's so thorough explanation. Great.
But like
So-
I said, it's a question, it's a common question from many, many people. And so, you know, I got better, you know, as the question keeps getting asked, I keep getting better at the answer.
It's